Welcome back to the Caregiver Minute, where every weekday family and professional caregivers gather to refine their skills, gain inspiration, and prepare to serve. I'm here today with my good friend and our medical director here to Mind for All Seasons, Randy Vawdrey, and we've been having a lot of fun this week. We've got a chiropractic physician and a mental health coach who are training with us to license the processes and the protocol that we use here in our business to help people improve their cognitive functioning. And we've had some really fun, interesting conversations. Randy was talking to them the other day about some experiences that he's had in his clinical practice related to the importance of dental health. And so I invited Randy to be a guest here on the Caregiver Minute and to share some of those insights and experiences. So Randy, tell us a little bit about what we were discussing the other day.
Yeah, so at the end of our discussions yesterday, I asked them what was the biggest epiphany of the day. And the chiropractor said, my gosh, I don't think I realized how much dental health affected their cognitive health or their brain health. And I shared with them this experience that I had a sweet lady from Michigan that came to town with a very advanced Parkinson's disease. And she'd been to several neurologists and she'd done all the conventional care that she could, and she was looking for a more natural approach. And so during our discussion, I asked her about her dental health, and her response was almost verbatim. My dental health is so good because my insurance only pays for 2 visits every year and I pay for an extra. I want a third because I just really love to have clean teeth. And I said, have you had any root canals? Yes, 4 root canals. Do you have any caps or crowns? Yes. Do you have any dental amalgam fillings? Yes. And I said, then I want you to get a cone beam CT scan. And she said, well, what's a cone beam? And a cone beam is really just a special CT scan that scans the mouth in 3D, because a dental x-ray is 2D, and it's kind of a pixelated picture. It doesn't have a lot of good resolution. So if you take a picture of the teeth through this side, it superimposes your teeth on the other side. So everything's kind of mashed together, and it just isn't, it's hard to look. It looks like a crappy, grainy picture. She did a cone beam CT scan, and she had 4 really deep dental cavitations. That's kind of medical terminology for a cavity that went deep into the root and up close to the sinus cavity. Well, she debated, do I go back to Michigan and fix this there, or do I fix it in Pocatello? And so she stayed in Idaho, fixed her teeth, and went home. And within about 1 month, she had a near complete resolution of her Parkinson's disease. I'm not exaggerating. It absolutely blew her mind. And she's actually recorded a testimonial and joined us for a lunch and learn and told her story. And so that's what the chiropractor said is, I don't think I realized how important dental health is to brain health.
That is such an amazing story. And I've actually interacted with this woman. It's incredible the change in her as a result of fixing that dental health problem. You know, one of the other things that came out the other day in our conversation, Randy, that was so fun was to hear about a family member that you've experienced a real shift in mental health, and it was totally related to an undiagnosed dental problem. Tell us a little bit more about that one.
Yeah, so I had a sweet family member that ended up fracturing the front tooth when she was a young lady and had a cap on that. And then she left our house for a couple of years and was off to school and participating in things that young adults participate in. And one day she sends me a text message and she lifted up her lip and she said, hey, what's this? How come I keep getting these canker sores? And I saw the picture and I thought, oh my goodness, she doesn't realize that's a dental abscess. And so I called her and said, you need to get into a dentist right away. And I was kind of aggressive. I'm like, don't wait, go right now, go to a dentist. This is kind of like the equivalent of an emergency. And she didn't get in till the following day. And when she went in, she did get a CT scan because the dentist knew that was abscessed and wanted to know how far up does that go. Well, the interesting thing is when I got a picture of that CT scan, the bone had totally dissolved all the way up into her sinus cavity. So instead of having bone that went all the way around her mouth, it's almost like she had this canal that went straight up, all the way up into her sinus cavity. And she had no idea this was happening. She thought it was a canker sore. Well, we have spent the last 6 months really working on trying to resolve that. She had to have bone grafting. She'd been on some antibiotics, all kinds of things. And we've recently talked about how much her mental health has improved. She struggled with a lot of depression, terrible anxiety. It seemed like she was kind of edgy and everything pushed her over the edge. So a simple stressor in life just became overwhelming. And now the resilience and the ability to cope with things that come at her, she's just kind of constantly in the flow and she's vibing really well. And I thought, I don't think that she realized how much her brain health was dependent on her dental health.
Isn't that mind-blowing? Now, one of the reasons that we share all this with you is that many family and professional caregivers are serving people who don't have very good dental health. And when Alzheimer's patients are autopsied after they die, almost 100% of them have P. gingivalis bacteria, the bacteria that causes gum disease in the brain. Many of the symptoms that we see outwardly, some of which cause some of the biggest challenges that we face in long-term care or serving someone in the home, are likely driven by dental health problems. So this underscores two things. Number one, we've got to do a really good job with oral care for the people that we're serving. And number two, it's worthwhile to get a cone beam CT scan and to really look for things that wouldn't show up on regular x-rays. We could go on for a long time telling you stories.
In fact, I got to tell one more story. A sweet little elderly lady came into our office to join our service here. And when she came in, the daughter said, "Hey, can you look at this rash on my mom? She's got this eczema that won't resolve." And I looked at the rash and I said, "Hey, that's not eczema. That's a vasculitis." And she said, "Well, I thought it was eczema. It was triggered by an allergic reaction to tryptophan." Now, for those of you who know what tryptophan is, it's an amino acid that's over the counter, and people buy it because it helps calm the mind, right? Helps people settle down. And I said, "That's not an allergic reaction to tryptophan. That's vasculitis. Can I see your teeth?" And she looked at me, she's like, "What does that have to do with anything?" But when she opened her mouth, I was thinking, oh my goodness. I mean, it was just total decay everywhere. And so my theory, my hypothesis was that that dental infection seeded into her bloodstream and drove this systemic vasculitis that the daughter thought was eczema. So again, I could tell you 10 stories just talking through this of how important that dental health is to brain health.
Oh, thank you so much, Randy. Well, thanks for watching today. We hope that you'll take some time today to consider what you could do to really help the people that you're serving improve their dental health. And you might want to think about that for you too. It's something that we try to be conscious of in our own lives as well. Thanks for watching. We'll see you again soon for another episode of the Caregiver Minute.